Hi everyone, my name is Mackenzie Scott, and today I'll be presenting an overview of multiple myeloma. My goal is to provide a clear understanding of what the disease is, why it matters clinically, and the essential roles nurses play in early recognition, supportive care, and improving quality of life. By the end, I hope you all have a strong sense of how the pathophysiology, clinical manifestations, and treatment approaches all connect to nursing practice. Here's a quick outline of what I'll cover today. We will start by looking at an overview and the prevalence of multiple myeloma. Then we will discuss the pathophysiology and systemic complications. Next, we will dive into the clinical manifestations and the diagnostic criteria. Then we will discuss interdisciplinary and pharmacological management. And finally, we will focus on nursing management, emphasizing the critical role nurses play in early recognition, treatment support, symptom management, patient education, and improving overall quality of life for individuals living with multiple myeloma. These sections together will help build a comprehensive, evidence based understanding of multiple myeloma, one that aligns with current best practices and supports improved patient care. Now that you have an overview of where we're headed, let's start at the beginning. To truly understand the complications and nursing priorities associated with multiple myeloma, we first need a clear picture of what multiple myeloma actually is. Now that you have an overview of where we're headed, let's start at the beginning. To truly understand the complications and nursing priorities associated with multiple myeloma, we first need a clear picture of what multiple myeloma actually is. Multiple myeloma is an aggressive hematological B cell malignancy, meaning that it originates from plasma cells within the bone marrow. In this disease, those plasma cells begin to proliferate uncontrollably, disrupting normal blood cell production and crowding out healthy bone marrow function. One of the defining features of multiple myeloma is the overproduction of monoclonal immunoglobulins, which are also sometimes referred to as M proteins. These circulate in the blood and may also appear in the urine. These abnormal proteins contribute to widespread systemic complications, including organ damage, immune dysfunction, and significant symptom burden for patients. Although multiple myeloma only represents about 1% of cancers worldwide, it represents a large population of hematological cancers. As you can see in the chart on the left side of the slide, multiple myeloma accounts for 10% of all hematological malignancies and is currently the second most common hematological cancer. On the right side of the slide, the bar graph shows a steady increase in the number of cases diagnosed over time. In 1980, there were just a few thousand documented cases annually. By the early 2000s, this number had risen significantly, and in 2025, we are now seeing projections of over 35,000 new cases per year in the United States alone. This rise reflects improved diagnostics, increased awareness, and aging populations. Although not the most common cancer, its expanding prevalence and increasing survival make long-term management a major focus of medical, surgical, and oncological nursing. Despite major therapeutic advancements over recent decades, multiple myeloma unfortunately still remains incurable. The current 5-year survival rate is around 60%, which means that while over half of patients live at least 5 years after diagnosis, a significant proportion do not, highlighting the seriousness and complexity of the disease. On the left side of this slide, the donut chart breaks down survival trajectories. We see that about 57% of patients diagnosed with multiple myeloma survive 5 years or more. About 24% survive between 2 and 5 years, and nearly 19% survive less than 2 years, often due to aggressive disease, high risk cytogenetics, or late stage diagnosis. There are several factors that strongly influence these outcomes. Delayed diagnosis is one of the most significant challenges since early symptoms like anemia, bone pain, and fatigue are often nonspecific. Treatment toxicities also impact survival because complications from chemotherapy, immunotherapy, and stem cell transplant can limit how aggressively patients can be treated. Additionally, relapse risk remains high as most patients will experience multiple relapses over the course of their disease. And finally, psychosocial distress, including the emotional burden and incurable cancer, plays a major role in both the quality of life and treatment adherence. Overall, while survival has improved dramatically over the years, multiple myeloma remains a complex chronic cancer requiring long term, multidisciplinary management to support both longevity and quality of life. Understanding today's outcomes highlights just how complex, challenging multiple myeloma is. But to appreciate how far we've come, it's important to step back and look at where this knowledge began. The history of this disease has shaped every advancement we use today, from diagnosis to treatment. So, next, I want to briefly walk through the early historical discoveries that first revealed what multiple myeloma actually was. The very first well documented case of multiple myeloma was reported by Samuel Solly in 1844 and involved a 39-year-old woman named Sarah Newberry. She initially presented with severe back pain, and unfortunately, she passed away about 4 years after her symptoms began. At that time, there were no diagnostic tests for plasma cell disorders, so her diagnosis was made entirely through clinical observation and ultimately autopsy findings. On the right side of this slide, you can see what the autopsy revealed. Sarah's bone marrow showed a red substance replacing the cancellous or spongy bone in the sternum and femurs, which we now know reflects malignant plasma cell infiltration. She also had multiple fractures involving the radius, ulna, tibia, fibula, and femurs. These findings are now recognized as classic hallmark signs of multiple myeloma. The next major turning point in the understanding of multiple myeloma came in 1873. This is when von Rostitsky officially coined the term multiple myeloma, marking the first time the disease was recognized as a unique medical entity. Von Rostitsky based this classification on the autopsy of a patient who had 8 distinct soft tumors within the bone marrow. What made this discovery so important is that he was able to determine that these tumors originated from abnormal plasma cells, not from bone tissue itself. This was a critical distinction because it shifted the understanding of the disease from a skeletal disorder to a plasma cell malignancy. This discovery laid the foundation for viewing multiple myeloma as a distinct hematological cancer and set the stage for decades of research. From this point forward, scientists began exploring the cellular pathology of the disease, tracing its plasma cell origins, and studying the various mechanisms that drive disease progression. This slide illustrates how diagnostic tools and therapeutic advancements have evolved over time to support early detection and more accurate diagnosis of multiple myeloma. Starting on the left in the early 1900s, one of the first major breakthroughs was the discovery of Bence-Jones proteins in the urine of patients with multiple myeloma. This became the first measurable biochemical marker for the disease and provided clinicians with an objective tool that could signal underlying plasma cell abnormalities long before modern imaging or laboratory techniques were available. Moving into the late 19th century, we see a shift with the introduction of X-ray imaging. X-rays allowed clinicians to visualize lytic bone lesions, which are characteristic of multiple myeloma. This was a major step forward because it offered the first non-invasive way to identify bone involvement, fractures, and skeletal weakening associated with the disease. Then, by the mid 20th century, both diagnosis and management advanced significantly. Several key developments occurred during this period. First, alkylating agents and chemotherapy were introduced, which changed treatment from being purely palliative to partially disease modifying. This meant that patients could finally receive therapies that slowed the progression rather than only managing symptoms. Second, major laboratory innovations were developed, including serum protein electrophoresis and immunofixation electrophoresis. Both these tests made it possible to detect monoclonal immunoglobulins, which are hallmark signs of multiple myeloma. For the first time, clinicians finally had reliable tools to identify the presence and type of abnormal plasma cell proteins circulating in the body. Now that we've reviewed how multiple myeloma was first recognized and how early clinicians identified its hallmark features, we can shift into what we now understand about the disease on a cellular level. So next I'll walk through the etiology and pathophysiology behind this malignancy. Now that we've reviewed how multiple myeloma was first recognized and how early clinicians identified its hallmark features, we can shift. The etiology of multiple myeloma is complex and multifactorial. Although the exact cause remains idiopathic, we do know that the development of multiple myeloma is influenced by a combination of genetic, environmental, autoimmune, and infectious factors, along with certain demographic risks such as age, sex, and race. These influences interact over time and increase the likelihood of plasma cell abnormalities becoming malignant. Recent research has identified several key genetic risk factors which play one of the most significant roles in driving this disease. Mutations in genes such as KRAS, NRAS, and TP53 disrupt normal cellular regulation, giving malignant plasma cells a survival and growth advantage. In addition, translocations involving the immunoglobulin heavy chain on chromosome 14 are strongly associated with the initiation of multiple myeloma. These genetic alterations transform normal plasma cells into clonal malignant cells, laying the foundation for the disease process. Understanding these underlying mechanisms is crucial because it not only helps explain how multiple myeloma develops, but it also guides emerging strategies for early detection and targeted therapies. Now I'm going to continue with the pathophysiology of multiple myeloma by explaining how the disease develops at a cellular level. On the left side of the slide, we have clonal proliferation of plasma cells. Multiple myeloma begins when mutations disrupt the normal regulation of plasma cell growth, specifically the pathways that control cell proliferation and apoptosis, or programmed cell death. Because these pathways are damaged, plasma cells begin to grow uncontrollably. This leads to several key consequences. First, there's a rapid expansion of malignant plasma cells within the bone marrow. Second, these cells produce large amounts of monoclonal immunoglobulins, also known as M proteins. And third, the overcrowding in the marrow suppresses normal hematopoiesis, which can cause anemia and leukopenia, increasing fatigue and infection risk. On the right side of the slide, we see how these malignant cells interact with the bone marrow microenvironment. The plasma cells stimulate stromal cells to release cytokines and growth factors. These signals activate osteoclasts, which break down bone, and suppress osteoblasts, which normally rebuild bone. This imbalance creates the classic skeletal complications of multiple myeloma: bone pain, pathological fractures, and hypercalcemia. These bone changes not only cause significant morbidity, but they also release additional growth factors that further stimulate tumor growth, creating a vicious cycle. Together, these two processes, the uncontrolled expansion of plasma cells and their destructive interaction with the bone marrow, explain many of the major symptoms and complications seen in multiple myeloma. Now I'm going to discuss the systemic effects that occur as malignant plasma cells expand throughout the body with multiple myeloma. On the left side of this slide, we have renal impairment, which is one of the most significant complications of multiple myeloma. Malignant plasma cells produce excess free light chains, and these proteins are filtered through the kidneys. When they accumulate in the renal tubules, they cause tubular damage, elevated creatinine levels, and ultimately renal insufficiency. This is why kidney function must be closely monitored throughout the disease course. In the middle section of the slide, we see immunosuppression. Because malignant plasma cells crowd out normal functional B cells, the body becomes unable to produce adequate antibodies. As a result, patients have reduced immune protection and are far more susceptible to infections. This is one of the leading causes of morbidity in individuals with multiple myeloma. And on the right side of the slide, we have what's known as the self-precipitating disease cycle. In this process, malignant plasma cells stimulate osteoclast activity, which increases bone resorption. When bone is broken down, it releases growth factors that actually feed the tumor, allowing it to grow even faster. This creates a vicious cycle where bone destruction fuels tumor expansion, and tumor expansion accelerates bone destruction. This cycle is central to the bone pain, fractures, and hypercalcemia that are also common in multiple myeloma. Together, these systemic complications highlight why multiple myeloma is such a complex and challenging disease to manage, and why early detection and comprehensive supportive care are essential. Understanding how malignant plasma cells alter bone metabolism, suppress hematopoiesis, and damage the kidneys help explain the hallmark signs and symptoms we see clinically. So, with that foundation in mind, let's look at how these internal processes translate into the clinical manifestations of multiple myeloma. Understanding how malignant plasma cells alter bone metabolism, suppress hematopoiesis, and damage the kidneys help On this slide, I'm introducing the clinical manifestations of multiple myeloma, which are essential for early detection and preventing complications. To begin, multiple myeloma causes a wide range of symptoms because it results from malignant plasma cell proliferation and multi-organ involvement. These manifestations often develop gradually, which is why early recognition by healthcare providers is so crucial. Here in the middle section of the slide, you can see the spectrum of clinical manifestations. These include physical symptoms such as fatigue, bone pain, and recurrent infections, laboratory abnormalities like anemia, elevated creatinine, or changes in calcium levels, and psychosocial effects including anxiety, depression, and reduced quality of life as the disease progresses. Below that, we highlight the classic CRAB criteria, which form the core diagnostic framework for multiple myeloma. CRAB stands for C, hypercalcemia, R, renal impairment, A, anemia, and B, bone lesions. We will go into more depth on each part of the CRAB criteria on the next slide. These features reflect the major organ systems affected by the disease and help clinicians recognize when multiple myeloma is present and when urgent intervention is needed. Overall, understanding these clinical manifestations allows nurses and other healthcare professionals to identify early warning signs, act quickly, and prevent the more severe complications associated with this condition. The classic clinical profile of multiple myeloma is summarized by the CRAB criteria, which stand for hypercalcemia, renal impairment, anemia, and bone lesions. These four clinical manifestations are the key symptoms of multiple myeloma. Hypercalcemia occurs due to increased osteolytic activity from plasma cell proliferation, which manifests as nausea, constipation, lethargy, and confusion. Renal impairment results from the deposition of light chains in the renal tubules, reflected by elevated creatinine levels, metabolic alkalosis, and proteinuria. Anemia is caused by marrow infiltration and decreased erythropoiesis, which manifest as pallor, fatigue, dyspnea, and tachycardia. Bone lesions are the hallmark sign of multiple myeloma, and they manifest as deep, aching pain, often in the spine, ribs, pelvis, long bones, and back. These bone lesions also increase the risk of pathological fractures and spinal cord compression. These clinical manifestations are the core diagnostic and symptomatic profile of multiple myeloma and explain how the widespread plasma cell proliferation of the disease leads to multi-system complications. Nurses and healthcare providers play a crucial and impactful role in early detection and intervention, reducing complications related to multiple myeloma and helping to improve the quality of life of patients living with this disease. Now I want to talk about the psychological and social impact of multiple myeloma, which is an essential but often overlooked aspect of patient care. On the left of the slide, you can see that the effects extend far beyond the physical symptoms. Patients often experience chronic pain, fatigue, and repeated hospitalizations, which can severely disrupt their daily functioning. Emotionally, many patients struggle with anxiety, depression, and fear regarding their prognosis. As the disease progresses, they may also experience a loss of independence, reduced self efficacy, and a sense of diminished role functioning within their families and the community. There are also significant social and financial implications. Treatment costs, frequent medical appointments, and caregiver needs can create a heavy burden for both patients and their families. Many individuals also encounter challenges in balancing their illness with work responsibilities, family roles, and spiritual well being. On the right side of the slide, we highlight the nursing role, which is critical in supporting these patients holistically. Nurses are often the first to recognize signs of psychological distress and play a key role in providing reassurance and encouraging healthy coping strategies. This includes connecting patients with counseling resources, social work services, and support groups. Nurses also ensure that care remains culturally sensitive and that patients' spiritual needs are acknowledged and respected. Ultimately, the goal of these nurses is to deliver holistic, patient centered support, addressing not only the physical effects of multiple myeloma, but the emotional, social, and spiritual dimensions as well. The clinical manifestations, especially the CRAB criteria, gives us important clues, but they're only part of the picture. To accurately diagnose multiple myeloma, we rely on objective laboratory markers and bone marrow evaluation. So let's transition into the diagnostic studies that confirm the presence of malignant plasma cells. The clinical manifestations, especially the CRAB criteria, gives us important clues, but they're only part of the On this slide, I am going to walk through the key diagnostic criteria used to identify multiple myeloma. First, looking at early recognition labs. Multiple myeloma often reveals itself through subtle abnormalities before major symptoms appear, and we commonly see metabolic alkalosis, anemia, and proteinuria. These findings may occur before a patient experiences pain or major clinical symptoms, which makes them extremely important for early detection and early intervention. Next, for key diagnostic tools, a comprehensive metabolic panel often shows hypercalcemia and elevated creatinine, both of which correlate directly with CRAB criteria. One of the most important tests is serum and urine protein electrophoresis. This is where we look for abnormal monoclonal proteins produced by malignant plasma cells. On the graph shown here, on the right side of the slide, you can see the classic M spike, which represents a sharp rise in monoclonal immunoglobulin levels. This is a hallmark finding that strongly suggests a clonal plasma cell disorder, such as multiple myeloma. Finally, the bone marrow biopsy is considered the gold standard for diagnosing multiple myeloma. It confirms the presence and percentage of malignant plasma cell infiltration, allowing for accurate diagnosis and staging. Together, these labs and diagnostic tools form a clear picture that helps clinicians recognize multiple myeloma early, confirm the diagnosis, and guide treatment decisions. With the diagnosis of multiple myeloma confirmed, care becomes a coordinated effort among multiple disciplinaries. Let's move into collaborative management now. With the diagnosis of multiple myeloma confirmed, care becomes a coordinated effort among multiple disciplinaries. Let's move into collaborative management now. With the diagnosis of multiple myeloma confirmed, care becomes a coordinated effort among multiple. On this slide, I'm highlighting the importance of interdisciplinary care in the management of multiple myeloma. Multiple myeloma, as we know, is a complex disease that affects multiple body systems. This means that no single discipline can adequately meet the needs of these patients. Current evidence shows that using a multidisciplinary, patient-centered approach, especially through multidisciplinary tumor boards, greatly improves communication and supports more consistent evidence-based decision making. On the left side of the slide, you'll see the key interdisciplinary team members involved in managing multiple myeloma. This typically includes physicians, nurses, pharmacists, dietitians, rehabilitation specialists, and mental health providers. Each specialty brings a different perspective that helps address the physical, emotional, nutritional, and functional needs of the patient. On the right side of the slide are the primary goals of interdisciplinary management. These include optimizing treatment planning so patients receive the safest and most effective therapy, addressing multi-system complications such as bone lesions, renal impairment, or treatment side effects, and ultimately improving the patient's overall quality of life. Now I'm going to move into the pharmacological management of multiple myeloma. Treatment for this disease requires a multimodal medication approach, and the primary goal is to control malignant plasma cell proliferation, prevent organ damage, and improve overall quality of life. First-line pharmacological therapy involves a combination of three key drug classes: proteasome inhibitors, which block protein degradation inside myeloma cells, causing those malignant cells to undergo apoptosis. Then we have immunomodulatory drugs. These enhance T cell mediated immune activity and strengthen the body's ability to target abnormal plasma cells. The third drug are corticosteroids. These help to reduce tumor associated inflammation and provide rapid symptom relief. These three medications work synergistically, which means they reinforce each other's effects, ultimately helping to slow disease progression and reduce tumor burden. If patients do not respond to first-line therapy, or if their disease becomes refractory, we move into the second-line options, which include monoclonal antibodies and CAR T cell therapy. These targeted therapies are designed to recognize specific markers on myeloma cells and selectively destroy them while preserving healthy tissues. Overall, the therapeutic outcomes we aim for with pharmacological management include better suppression of the disease, measurable reduction in tumor burden, and longer remission periods, which translates to improved survival outcomes and quality of life for patients. These medications form the foundation of modern multiple myeloma treatment and are essential in supporting patients through the disease trajectory. Now that we've reviewed the pharmacological management of multiple myeloma, I'm going to move on to the advanced therapies and supportive care that play a crucial role in improving patient outcomes and quality of life. First, we're going to look at rehabilitation and supportive care. First, supportive care is essential because multiple myeloma affects patients on physical, nutritional, and emotional levels. Physical therapy is important for maintaining mobility and reducing fatigue. Many patients experience bone pain and muscle weakness, so PT helps prevent deconditioning and supports safe activity. Next, nutritional support is a major component because hypercalcemia and nausea can lead to dehydration or poor intake. Maintaining adequate calories, hydration, and protein is essential, especially during treatment phases that increase metabolic demand. We also emphasize psychosocial support here. The emotional burden of multiple myeloma, fear of prognosis, depression, anxiety, they can all significantly impact how patients cope and adhere to the treatment. Support groups, counseling, social work, and spiritual care all serve to help patients manage stress and maintain a sense of control and well-being. Secondly, we have an autologous stem cell transplant. This stem cell transplant remains the gold standard for patients who relapse or become refractory to medication. Although not curative, this therapy provides longer remission periods and improved progression-free survival compared to standard chemotherapy. In this procedure, the patient's stem cells are collected, stored, and later reinfused after high-dose chemotherapy. This allows the body to recover more effectively while also aggressively targeting malignant cells. Combined, these interventions address the full spectrum of needs for patients with multiple myeloma: physical, emotional, and biological, ensuring a holistic, patient centered approach to care. All members of the care team are essential, but nurses are often the first to recognize complications, address symptoms, and guide patients through complex treatment regimens. For that reason, nursing management deserves specific attention. So, next, we'll examine the core nursing interventions that directly influence outcomes and quality of life. All members of the care team are essential, but nurses are often the first to recognize. On this slide, we highlight the core priorities in nursing management for patients with multiple myeloma. Because this disease affects multiple body systems and involves invasive, long-term treatment, nurses play a central role in maintaining stability and improving quality of life. First, pain control is the top priority. Bone pain is often the most distressing symptom patients experience, so nurses must perform frequent pain assessments, administer prescribed analgesics, and monitor the patient's response. Effective pain management allows patients to remain mobile and engaged in their daily activities. Second, infection prevention is critical. Due to immunosuppression from both the disease and its treatment, infection is one of the leading causes of morbidity in multiple myeloma. Nurses promote proper hand hygiene, reinforce neutropenic precautions, and provide education on how patients can protect themselves at home. Nurses also monitor lab values like white blood cell counts and renal function, which allows for early identification of infection or treatment toxicity. Third, management of treatment toxicity is essential. Medications used in therapy, such as immunomodulators, proteasome inhibitors, and corticosteroids, come with side effects that require close monitoring. Nurses are responsible for tracking lab results, assessing for complications, and ensuring that adverse reactions are addressed early to prevent complications. Finally, ongoing psychosocial support is a key priority. Patients often experience anxiety, depression, and uncertainty throughout the course of this disease. Nurses help patients build resilience by providing emotional support, involving family when appropriate, and connecting patients with counseling or support groups. This holistic support strengthens coping and treatment adherence. Overall, the main goal of nursing management is to maintain the patient's quality of life and support adherence to treatment. Nurses are present throughout every stage, physically, emotionally, and educationally, to ensure that care is both effective and compassionate. As we discussed on the previous slide, pain is the most distressing and most common symptom for patients with multiple myeloma due to bone lesions, fractures, and disease progression. As nurses, our role includes performing frequent pain assessments, administering prescribed analgesics and biphosphonates, helping patients maintain mobility and comfort. Effective pain control not only improves their physical functioning, but also enhances emotional well being and treatment adherence. Next is infection prevention, which is absolutely critical. Infection is actually one of the leading causes of morbidity in patients with multiple myeloma due to immunosuppression and treatment effects. Key nursing responsibilities include providing hand hygiene and infection prevention education, instituting neutropenic precautions when needed, and monitoring white blood cell and renal labs to detect early signs of infection. Because early recognition saves lives, nurses play a vital role in preventing complications. Lastly, we must closely monitor for treatment related toxicities. Multiple myeloma therapies, while life extending, often cause side effects such as renal impairment, cytopenia, and medication toxicities. Nursing roles here include early identification of complications, monitoring lab and vital signs for subtle changes, and recognizing signs of renal dysfunction, cytopenias, or medication intolerance. A nurse's ability to identify these issues early allows the care team to intervene quickly and prevent serious harm to patients. Another essential component of nursing management in multiple myeloma is providing psychosocial and holistic care. Because this disease is chronic, unpredictable, and often emotionally overwhelming, patients experience far more than physical symptoms. On the left side of the slide, you can see the psychosocial challenges patients commonly face. Things like anxiety, depression, fear of prognosis, and uncertainty about the future. Nurses play a major role here. We help promote resilience by offering emotional support, facilitating counseling or referrals to mental health services, and involving family and care planning when appropriate. On the right side of the slide highlights the holistic or whole person approach. Our care, our care extends well beyond symptom control. We address emotional, social, and spiritual needs. Nurses empower patients by promoting self efficacy, and they reinforce education to improve adherence and safety throughout treatment. Culturally sensitive, compassionate communication is really important here because it builds trust and helps patients feel supported during a difficult and often long treatment journey. Overall, psychosocial and holistic nursing care is just as essential as managing pain or monitoring labs. It's what truly supports the patient as a whole person and helps them maintain quality of life. Because nurses play such a central role in day to day care for patients with multiple myeloma, their involvement significantly affects patient outcomes and quality of life. With that in mind, let's wrap up by reviewing the key points from today's presentation and the overall clinical significance of multiple myeloma. Because nurses play such a central role in day to day care for patients with multiple myeloma, their involvement significantly affects patient outcomes. As we wrap up this presentation, this slide helps bring everything full circle. Multiple myeloma remains a complex and serious diagnosis, but it also is a disease that is becoming increasingly manageable with today's evidence based therapies and interdisciplinary approaches. We've seen how advances in diagnostics, pharmacological intervention, innovation, stem cell transplantation, and supportive care have dramatically improved both survival and quality of life. But what truly ties all these pieces together is the coordinated effort of the healthcare team, each providing a vital piece of the puzzle. And at the center of that team are nurses. Nurses bring continuity, advocacy, symptom management, emotional support, and patient education, ensuring that patients never walk this journey alone. Their presence is often what transforms challenges into manageable moments and uncertainty into hope. So as we conclude this image of puzzle as we conclude, this image of puzzle pieces symbolizes exactly what multiple myeloma care represents. A complex picture that only comes together when every member of the team contributes, especially nursing. Together we help patients with multiple myeloma move forward with strength, dignity, and confidence. In closing, multiple myeloma care demands collaboration, compassion, and clinical excellence, and nurses are truly at the heart of it. Through early recognition, patient education, symptom management, and holistic support, nurses profoundly influence both the quality of life and outcomes for patients facing this complex disease. As we conclude today's presentation, I want to leave you with this thought. Multiple myeloma is a long journey, but no one walks it alone. Nurses become the steady strength that carries patients forward. This truly captures the heart of multiple myeloma care. While treatment is complex and the challenges can be overwhelming, patients never face them in isolation. Nurses are there at diagnosis, through treatment, through setbacks, through victories, providing not only clinical expertise but compassion, advocacy, and unwavering support. Thank you so much for taking the time to learn about this disease, its impact, and the essential role that nurses play. Together, we can continue to elevate care, empower patients, and bring hope to every step of their journey. Before we wrap up, I'd love to get everyone involved with a quick interactive review. On this slide, you'll see a QR code. If you take out your phone and scan it, it will bring you directly to a short Kahoot quiz based on today's content. This is just a fun way to check our understanding and reinforce the major points we've covered about multiple myeloma. I'm going to give everyone a moment to scan the QR code and then we can get started. Before we wrap up, and finally, here is the reference page for this presentation. To keep the slides clean and easy to follow, I've included a QR code that contains all of the full API citations that have been used throughout this project. Feel free to scan the code with your phone, and it's going to take you directly to a document with every source, including peer-reviewed articles, clinical guidelines, and supporting evidence for the content that has been presented today. And finally, here is the reference page for this. And that brings us to the end of my presentation. Thank you so much for your time, attention, and engagement today. If you have any questions, would like clarification on anything I discussed, or want access to any of the resources I used, please feel free to reach out to me at the email listed here, mackenzie.scott@my.colby-sawyer.edu. Once again, thank you, and I hope this presentation helps deepen your understanding of multiple myeloma and the essential role nurses play in improving the lives of these patients.